Hello, I'm Jeremy Faust, editor-in-chief of MedPage Today. This is Exit Interviews, a series in which we will be speaking with former Biden administration officials about their roles in the administration serving United States public health. I'm so happy to be joined today by the two-time former FDA Commissioner, Dr. Robert Califf. Dr. Califf, thanks for being here.
Good to be with you.
We're calling this Exit Interviews. We're talking to people who were in the hot seat and now have a view on the outside looking in. So I'd like to start by reviewing a little bit about your time as commissioner of the FDA. And I'd like to start by asking you, what was the most challenging part of working in the last administration?
I'd say, in terms of challenges, I would just say it was a very difficult political time. Congress was very dysfunctional. People couldn't get along with each other and were very dependent at a federal agency on reaching agreement with Congress on how to proceed. And that was probably the toughest thing for me. Now, keeping in mind, I'd already been commissioner one time, so some of the things that might have been difficult otherwise, I pretty much was, I'm not saying I was good at them, but I expected them, so I didn't find it that difficult.
So if I'm hearing you correctly, the challenge for you was not necessarily anything within FDA itself, but more about policy at a higher level?
Right, and within FDA is made up of a bunch of really highly committed people, and there are plenty of issues within the FDA. And in fact, as you know, we did the largest reorganization in the history of the FDA and told what just happened in the last 2 months. So, yeah, there were plenty of issues to deal with within the FDA, but I think the dysfunction in Congress made a lot of things much more difficult than they needed to be.
Well, could you give me like an example of how congressional dysfunction made life at the FDA more difficult?
Well, I could give you a lot of examples. One easy example would be the regulation of what you might call something that we thought about starting a Center for Bad Decisions. These would be all the things that are readily available in the U.S. which do harm, but are sort of used by consumers for a variety of reasons and have their advocates, like Kratom would be a good example. Vaping, in a way, is a similar example. There's no health benefit of those things, so it doesn't fit into the paradigm that was set up for drugs and devices, where presumably you're trying to improve health as a primary goal. Marijuana would be another example. We should have been able to figure out how to create a regulatory system for those things that work, but it was impossible. I mean, I remember one hearing where the Republicans got into an argument with each other about marijuana. Nancy Mace said it should be readily available, and Daniels said it should be illegal completely. And where legislation is needed, you got to have Congress in agreement.
I'm really interested in vaping because I think of vaping as analogous to things like opioid replacement therapies like buprenorphine or methadone. I wouldn't start patients on buprenorphine or methadone for any reason other than as harm reduction. Do you not agree that vaping is harm reduction for a lot of people who otherwise would be putting tobacco that we know has a 30-fold increase of cancer into their bodies?
Well, this issue is just a window into what I think the primary issue at play is about the tough policy issues with FDA. If I were king, I would completely agree with you, and I would institute a regime, much like Australia has, where you're simply not allowed to vape unless you go to the drugstore and pick up vaping material to treat your addiction to nicotine, which is leading you to use combustible tobacco. But in American society, people believe they have the individual right to do things that they want to do, even if it harms themselves. And the one exception that we've generally made is children should be protected. So that's why we've ended up with a set of laws which essentially permit vaping as long as the manufacturer meets the standards of the FDA. And we don't, if someone comes in at age 22 and says, I want to vape for the first time, they're perfectly entitled to do that, because in America, there's a strong belief that people should have freedom to do things that are even harmful.
Yeah, well, certainly the idea is that they hopefully won't harm others, which is why we've banned smoking in public places, for example.
Well, Jeremy, let me just say, harming others That one is in contention too. I mean, guns would be the primary
Yeah.
example of that. So I think there's a real fundamental question that relates to the whole spectrum of issues that raise a lot of controversy because we haven't come to grips across society about these different views of, this old statement, your right to freedom ends at the tip of my nose. Some people believe that's not even the case.
Well, yeah, and since you're interested in it, let's take a little bit further. I think you're right that this line is unclear where it is in this country versus where it should be, and it's different on different issues. And I think the one that I think maybe people don't always realize is seatbelts. People used to think, oh, well, what difference does it make if I don't wear my seatbelt? I'll die. It won't affect anybody else. But that's not true. I think sometimes we don't consider these secondary effects when we're talking about what you just said, where the line is between my rights and yours.
Again, much like vaping, I'm personally in agreement with you, but I think if seatbelts came up today, we'd have quite an interesting societal discussion. And I'm not sure how it would come out. I
That's
think our
depressing.
society has moved.
That's really depressing.
Well, part of what I would say today is you should be both anxious and depressed at this point. But hopefully
Well,
that'll motivate people to act.
yeah, I'd say I would categorize a lot of people in my echo chamber as depressed and motivated, anxious and motivated, but motivated. Okay, let me ask you another question, which is that now you've made this transition. Obviously, we have a new FDA commissioner, and I'm curious what your advice would be for any incoming FDA commissioner, but especially this one, who, by the way, is Marty Makary, my predecessor here at MedPage Today.
Well, the general advice for any FDA commissioner is, first of all, get to know the people that work there. It's a highly dedicated workforce with a lot of knowledge about whichever area of FDA they're working in, and can really give the commissioner guidance on places where improvement is needed, where new policies may be needed, and what the history is that has led to a situation that currently exists. Oftentimes it's surprising how things got to be the way they are, but if you don't know the reasons, you may fall into a trap of espousing things which are impossible to do or maybe have already been tried. And then it's insist and rely on the evidence. And I know Marty in the past has argued strongly about the need for better evidence, and I hope that will continue. Right now, I would just say he's only a couple of days into the job. We need to give him a chance to see what he can do. But I also have to say he's walking into a tough situation. Any organization that you enter when well over 20% of the workforce has been fired, and with so much political interference already into the activities of the FDA, this is going to make his job really a difficult job.
I have two follow-ups to what you just said. And the first one, I'll go in order in which you said them, which is that going into the FDA, you have to know some things which are possible and know which are not. And can you just give me an example of that? Because I think people would like to know, like, what is something that someone had tried but just couldn't be done because of the way things are set up?
Gosh, there's so many, but one on my mind that's on my mind a lot right now is nutrition. And the FDA is not the primary actor in nutrition, but it does label the food and it has a significant role to play. But you could say, well, I'm FDA commissioner, so I'm going to declare that we will make the food more nutritious. Well, then there are a lot of things that would have to happen, one of which is you'd actually have to have a budget so that you had people who could do it. And Congress has repeatedly denied budget increases for the tiny little group at FDA that's worked on nutrition. Or, sort of related to that, you might say, let's get rid of chemicals that may be risky in the food. Every investigation of a dietary supplement or food additive requires a team of people with a whole variety of knowledge about biology, food itself, epidemiology. The risks are typically very small and incremental and often very arguable. because if you are going to, for example, outlaw a dietary ingredient, you got to pass a federal rule. That means you have to write it out, write the scientific justification, put it out there for notice and comment, wait a year, and then finalize it. And during that time, the affected industry can contest it and can take you to court. And if you don't have everything just right, even if you're right in substance, if you violate the Administrative Procedures Act, I mean, a great example of where that happened is graphic labels for tobacco. We're the last high income country in the world without graphic warnings on combustible tobacco packages. And we almost got there in my first term in 2016, but the court ruled that we were violating the First Amendment rights of the tobacco industry to say what they wanted to say on the front of the package.
Hmm.
And we've gotten some favorable rulings, but it took it took 5 years because you had to go back and redo the whole thing. So there's so many examples like that where you have to know what it really takes. And slogans are useful, but they don't actually get the job done.
I mean, when I hear you talk about that, it makes me think, okay, there are some dyes in foods that people are all excited about, and it's been shown to have, some association, but with some outcomes, but it's really flimsy. Do you think that the bar for these kinds of things is appropriately set, or do you think it's kind of like, to use the word from the Administrative Procedure Act, a little arbitrary and capricious if we decide, let's ban these dyes and the companies can sort out the problem?
You see, Jeremy, this is why I think in general we need to regard the FDA as more like a referee than the team owner.
Yeah.
Um, the FDA is limited, and especially now after a whole series of Supreme Court rulings during my term, is limited to acting within the law as is written by the Congress, which the Congress is the team owner. It writes the rule book. And in the case of chemicals in the food, I think the bar is in the wrong place, but the FDA commissioner can't change that bar, nor can the HHS secretary. It's Congress that has to change it, or you're going to lose in court. And what's at stake, in Europe, there's more of what's been called a precautionary principle. If there's some chance that there might be a risk, then it's more likely that they won't allow it on the market. In the U.S., you actually have to have substantial evidence that there is a risk. And red dye number 3 is a really good example, right?
Right.
Because red dye number 3 causes a non-malignant tumor in I think it's a male species of a certain kind of rat.
At high doses.
Yeah, at very high doses, which is nothing like what a human being ingests. And the non-malignant tumor is not something that's ever been seen in a human being. But the Delaney Clause says if a substance causes cancer in any animal, then it can't be allowed on the human market. That's a very old law. And so there's also some evidence, by the way, which I think that maybe hyperactivity in teenagers that get a heavy dose of. So that was enough to finally take this over the hurdle. But the headlines would make you think, geez, we finally took it off because this stuff obviously causes, serious cancer in people. We actually had no evidence of that.
You mentioned that that Marty Makary comes into the FDA now in a really contentious moment that is not his design. He did not come in and say, I'm going to cut a certain percentage of the FDA's workforce overnight and do all of that. That was done before he was confirmed. That was done by outside of FDA. And he walks in literally 2 days after, or a day or two after, thousands of people have been terminated, and has to give a welcome lecture. He's got a really, my sense is that the morale is low right now, but it's not his fault. How does he overcome that?
Well, first of all, I just have to say, I don't know how much he was involved. I don't know Marty. I haven't talked with him. It would be unusual for major moves to be made in a federal agency knowing who was the nominee without discussing it with him. So I do think in what's been promised to be an era of radical transparency that he should make clear whether he was for or against the cuts that were made and the way it was done. Because you describe morale as low. I would say, well, let's say that you walked into work today and your badge didn't work, and you learned that you had been fired 2 hours earlier in the morning, but they had cut off your email access before you got fired, so you had no way of knowing. And now you're put in a public line of people that got fired for everyone else to see who's not been fired. And let's say you're in the line of not fired. How would you feel about coming to work in a place like that? What confidence would you have that your job is secure and that people even care that you're a human being? I've never, I've been involved in RIFs because I used to run a contract business in academia that did clinical trials. And when you have a big clinical trial and it ends and you don't have another one to take its place, you can't pay the employees, so you have to do a RIF. You can do, if you got to reduce in force because there's a good reason, you can plan it out. You can help people find other jobs. There's all kind of things that you can do. None of that was done. So you're right. He's walking into this, and I think when I'm hearing from FDA employees, they want to know where he actually stands on this.
Mm-hmm.
What is his view on what should happen at FDA? What is his plan?
Let me ask you well, first of all, you did some reorganization at FDA. I would like you to tell us what that entailed. And as a follow-up, I would ask that even with that, if today you were to be appointed back to that role and they somehow found a way to get you to do it, because I know they had to convince you the second time, but if that somehow happened, what would you do if you had to reduce the FDA's workforce by 10%?
Well, all right. So, first of all, when we did our major reorganizations in that, they were in tobacco and food and the inspectorate, we spent months, first of all, getting external people to come in and do an evaluation to get a complete list of what needed to be done. And doing it not sort of like descending on the FDA and doing an evaluation. They actually interacted with the FDA staff quite a bit and also with people who had worked at the FDA and left. And then we engaged the staff in a very extensive let's design the reorganization effort together. So that when it came time to do the reorganization, we had hundreds of people who had volunteered to be agents of change and they were ready to go. And, I'm not saying it's perfect. There were people who were unhappy, who didn't want to change what they were doing or who had to change that might have even involved a move or something like that. Now, you used the number of 10%, and I, I've been thinking about this a lot because I get asked a lot, don't you have all these lazy, worthless, shiftless employees at FDA who don't do anything? And first of all, the answer to that is no. This is a really, I've worked in academia, I've worked in healthcare delivery, I've been at Alphabet, I've been on the board of small biotech companies. This is as hard a working group as I've seen anywhere. If you look at what they did during the pandemic of handling the pandemic plus all the usual business, it was a remarkable thing.
Mm.
But it's also true, and it's well known, that the federal employment system has issues. And it's reflected actually in the surveys I talked about. The place that FDA scored the lowest was I get recognition for the good work that I do. And if you dove deeper into that, what you saw was what they were really saying was, if I work in a group and there's somebody not doing a good job in the group, nothing happens to them for not doing a good job, and I have to pick up their work. It's just hard to deal with that the way you would in any other sector in the government until now, where they just completely disregarded everything about workers' rights and fired
Mm-hmm.
people summarily with no recourse. So 10% I could handle. I've estimated that out of the 20,000 people, there may be 1,000 people who, you know, would be better off doing something else. And again, I want to come back. When you do that, almost everybody has a place. And if you actually have an HR effort, you can find a place for them where they'll actually be happier because they'll be doing work that they're suited to do. But if you said 20%, I would say I wouldn't sign on to that job.
Mm-hmm.
Because they're going to be at a 20% loss. They're going to be critical public health functions that don't get done. And, I've heard all the analogies. I mean, one, the pothole analogy is probably a pretty good one. If you don't fix the potholes, you save money. Then something bad's going to happen at some point. You don't know when it is. And it could be a number of different potholes in different places that might cause the problem. And that's where we're headed right now. This is nonsensical to me. And then today I read this thing that said RFK said 20% of people were incorrectly fired. I, if you had any sense of the human condition, you
Yeah.
would have planned your firing to at least get that right, so you didn't. And then I also heard there were people who were called and said, "Well, you're fired, but why don't you come back and help with the handoff just for a few days?" Well,
Yeah.
boy, oh boy, what a way to
Right.
treat people.
My argument there was, what was the hurry, right? If you wanted to do this, why did you have to do it in essentially 60 days without engaging people in different levels of the organizations or the agencies to say, where are the places that we can improve and how do we make a handoff happen? How much of this is reversible, both in the short term, if the administration realizes, oh, actually, we do need support staff for our investigators to be able to go do a site visit. How quickly can they fix this? Or if they don't care, how can the next administration say, all right, let's just, back to the way it used to be. Let's get this place up and running again.
Well, I think you may know this. What crossed my mind when the RFK statement about pack your bags and preserve your records was made. My reaction to that was, doggone right, you better preserve the records, because in the analogy that I use is Humpty Dumpty.
Right.
And Humpty Dumpty's going to have to be put back together at some point. There's a reason the whole history of the FDA is people say, why do we need all these regulators? And then something terrible happens and they say, well, where were the regulators? And then a law gets passed
That's
and
right.
you got regulation. So if this is untended, there will be potholes and bad things will happen, and people will realize it's got to be put back together. Now, I think it's eminently possible to put it back together because there are a lot of people with institutional memory and they have preserved the records. And I think it's even likely that it could be put back together in a better way, because much like I described the personnel issue of what do you do with someone who's not cut out for the job they're trying to do. There are other things in the bureaucracy and the way the FDA is organized that could clearly be better. And I think there may be a great chance to put together an even better organization, especially realizing we're marching into this future of AI and amazing biologics. I mean, the latest thing for me, just being on the outside, realizing we may be able to give one injection that will treat blood pressure and lipids for 2 years. What a whole different world for some of the biggest causes of death and disease. And of course, we got all the rare disease. And let me put in a plug here. If there's one area I'm worried about in the short term, it's the rare disease genetics issue. And I'm very worried about this mRNA thing, because it's not just gene editing, it's also knocking up or knocking down gene function using molecular methods that could make an enormous difference for people that are dying now and have no other treatment. But if there's no one to help with the regulation who understands the complexity, this stuff also could be very dangerous if it's not well regulated.
All right, my last question is this, Dr. Califf. You always come across to me as level-headed. You think before you speak. You're a measured man. But I also know that inside you're mad as hell about what's going on, and you see that you're bearing witness in our conversations and LinkedIn and everywhere you go about your feelings on this and the cynical nature that you think is behind it. But if they came to you and said, "Hey, Dr. Califf, you know what? We need your help," would you help them? Would you serve? Not necessarily take a job in the FDA, but are you available to this administration to help them clean up any mess that they may have created?
Well, I consider myself a patriot, and much like I'm sure with you, once you've been a doctor on the front lines, you're there to help people. I think the complexity of when to help may be exemplified by the employees who are being asked to come back just to pitch in until their firing takes place
Yeah.
comfortably. Um, I and if I'm told to come back and help in a situation where, like what apparently happened with the vaccines, where you're basically being told the answer is it's risky, don't bring me anything else, I wouldn't help with that. So, um, so if it's a genuine, can you help? I do it. And let me also say, I'm not haughty enough to think I know all the answers. That's not what I'm saying. But you got to, the history of the FDA is people who run the centers, especially having independence from the politics and looking at risk and benefit in an honest way. And that's really what we need. We got to keep the political interference out of the activities as much as we can. Final
Well,
thing on that,
yes.
here I'm talking about product decisions. When it comes to policies, it is inherently political, right? And so I'm not saying the policies are not political. They are, and they should be. And so, two different spheres.
Well, I think that regardless of who is right and who is wrong, and we of course have our opinions on that, we would all do better to make our echo chambers a little less echoey, and that this administration should walk the walk of inviting dissent, because if that happens, I think a more robust conversation and progress is possible. Dr. Califf, thank you so much for joining us.